Okay, hello guys. Hello, how is everyone doing? Welcome back. I'm Dr. Sylvia and I'm a consultant in general practice. I run AskAwayHealth and this YouTube channel, and I'm so glad that you're joining me today, especially on the replay. We're tackling questions coming from our viewers for this episode. And I've got a couple of questions that we're going to be looking at today in just a moment. But guys, if you're just jumping into this live, do me a favor and please like it, and of course subscribe to the channel if you haven't done that already. Welcome. I hope you're all doing well. Hope you've had a great last week and looking forward to another week. So we've got two questions that we're tackling today, and we're going to be responding to somebody's inquiry about Depo shot. But before that, I wanted to very quickly address one question I got about vulval itching and lump in response to one of my videos. So we'll do that very, very quickly, I promise, and then we'll go on to the main thing, which is the Depo shot. So this question from a viewer, and guys, please don't forget, remember that I'm providing information simply to signpost, not specifically to treat, because I cannot offer specific treatment. Somebody came onto one of my videos and commented and said, I didn't find specific treatment. Well, you wouldn't find specific treatments in a video from a medical practitioner who is doing their work ethically and in the way that we're supposed to be regulated, because we don't know your medical information. We can't just give you specific treatments online. We do need to know specific information. But in terms of providing general guidance, that's fine. Anyway, so this question, let's quickly tackle this question. Somebody said, hello, I just want to know what are the causes of itching on the pubic area. I experienced this on and off itching since November 2023, and 3 weeks ago there was a small bump which seemed like caused by ingrown hair. Not sure, I just ignored it, but I was shocked one morning it suddenly became bigger. What could be the reason? I'm somewhat paranoid already. I understand. I really want to tackle the issue about the itching, which is quite common. Many women do experience itching in the genital area. I know they said pubic, but that's, also genital area. And of course, it could be around the pubic hair, or it could be lower down. So within the, around the labia, so right down into the, just before the entrance of the vagina. So there could be itching in that area, or even in the skin or the tissues around that, going towards the inner corners of the legs, or going even beyond that. So you could have both itching around the hair and then around the tissues, and then of course going towards the entrance of the vagina and the labia. So all that could constitute itching. Of course, there's so many different causes, so we're going to just touch a few of them just for the sake of information, because at the end of the day, if somebody has had on and off itching since November, we're what now? This is March, so that's what, 5 months, going to 5 months. So if this is going on and off, I would recommend, of course, that she's seeing her doctor, having an examination of the tissues, because there could be different reasons. And what you need is to go through the different symptoms, find out if anything else is going on in her medical history that will then guide us to the possible cause. Okay. And there's some of them, for example, lichen sclerosis, which by looking, you can actually say, wow, this is lichen sclerosis and this is the treatment. So that is why it's important to sit and talk to your doctor and then have an examination. But generally, with no particular order, of course, itching around the genital area could be from infection, as many of us know. So it could be from something like thrush or yeast. It could be things like lice. You could get pubic lice, so similar to the lice you have on the your hair or the head. And you could also have scabies in that same area. So if it can affect skin anywhere else, there's no reason why it can't affect the genital area, is the point I'm trying to make. So the lice or the scabies, the lice can live in the hair, the scabies can grow around the tissues in the genital area. So those are possibilities. Of course, sexually transmitted infections like chlamydia, gonorrhea, genital warts, herpes could cause itching. You could also have a condition like bacterial vaginosis, which is not sexually transmitted per se, and could be because there's something going on with your vaginal pH, and that increases the chance of you picking up that particular condition. But it can also be associated with a lot of very uncomfortable itching. Now, apart from, so there are different possibilities in terms of infections. Related to that, you might just have inflammation of the vulva and the vaginal tissue that is not because of any sexually transmitted disease. We've talked about thrush, we've talked about BV. So those are possible causes that where infection could lead to itching in the pubic area, in the genital area. Another thing is skin changes. Okay, so changes to the skin. This is not infection. So the skin is not healthy. The skin is not happy. It's inflamed. Now, possible causes, it could be dryness. So it could be dryness because of eczema, as many of us have. So people with eczema and affecting the area around the genitals, the vulva, vagina, may also experience itching. So that's a possible cause. And given that she's having on and off, you have to think, could it be something that the skin is not very happy? Could that be the reason that this is going on? Apart from eczema, there's also a condition called psoriasis that could also cause inflammation and itching. Excessive sweating or wearing damp clothing, that might be related. If you're not keeping the area between the thighs or in the genitals, if they're being kept in a very uncomfortable moist condition, either because one is not changing underwear regularly or washing regularly or just sweating excessively, that could make the whole area uncomfortable, irritating, and that can increase the risk of itching. And of course, hormone changes, and now I'm talking about as we grow older, where the skin and the tissue around our vulva, vagina, and the skin just in that general area becomes thinner thanks to hormone balance or hormone changes. That can lead to inflammation, that can lead to dry skin and itching. So those are some of the other causes that affect the skin for different reasons, because of direct skin conditions like eczema or because of hormone imbalance. Something else to think about in terms of what could cause itching around the pubic or genital area is if you're allergic or if you're sensitive to different things. Now, sensitivity could be to types of fabric. So we're looking at the type of clothing or underwear that you're choosing to wear. So some ladies find that they're particularly sensitive to certain types of material, and it could be your underwear, it could even be your gym wear, or it could be if you're putting on what are those things now? G-strings or gym wear made of certain types of lycra. Some people are sensitive to them, so you need to watch it and see if that's something that might be contributing to yours, if that is the case. By the way, guys, thank you so much for joining. If you're watching, really appreciate that. If you've got a question or related to the topic, pop it in the comment section for me. Otherwise, give the video a like and yeah, share it. I'm just glad to have you around. And if you're watching on the replay as well, thank you so much for checking in. So we're talking about sensitivity. I've mentioned fabrics, but of course, sensitivity to other things that we use around the area, creams, soaps, deodorant sprays, and whatnot. That list of things. Many people are actually quite sensitive to them. So it's really important to have that at the back of your mind in terms of whatever products that you're using. So soaps and shower gels, bubble baths, feminine sprays, and of course, for those who use douches, which we don't recommend, particularly because of the trouble that it can cause, but some people still go ahead and use them. And so they might find that using the douche, which means actually applying some kind of feminine wash or, whatever preparation within the vaginal canal, could cause irritation. It could tamper with the vaginal pH, and that could lead to, inflammation and irritation and things like that. Certain types of birth control. Some people use birth control that has spermicides, for example, on their diaphragm, or there's natural birth control gel Phexxi, which I've got a video somewhere in the channel on Phexxi. I think I did that last year or so, just looking at Phexxi for those people who don't want hormones. Phexxi is an option. And of course, things like different creams, lotions, your soap, your washing detergents, your even fabric softeners as well. And scented wipes. How did I forget that? Scented wipes or scented tissues, scented sanitary pads and things. There's so many things you can think about potentially that could cause irritation. So have that at the back of your minds. And then, of course, there are conditions like diabetes, especially if it's not well controlled, or rare conditions like vulval cancer. So if it's not getting better, and I'm definitely not saying that this is the case in this instance, because there's so many things that we don't know from this question. I don't know how old she is. I don't know what other symptoms she might have. So I can't say it is this or the other, and I can't offer any treatment. But I do think it's been going on for a while, hasn't it? So it's good. It's a good. She needs to sit down with her doctor. But yeah, vulval cancer. If there's itching that's not getting better, and if you notice there's a change in the thickness, in the feel of the tissues or the skin around the vulva, it's a good idea to sit down with your doctor. Yeah, those are some of the possible causes of itching around the pubic or vaginal area or vulval area. Then she mentioned a small bump, which she thought seemed like an ingrown hair. Fair enough, that's the potential cause of a lump. And then she was shocked it just got bigger one morning, or I don't know, maybe it got infected. Who knows? Maybe it got infected. Or maybe she'd been scratching at it and it was just getting sore. What could be the reason? Well, listen, I know a lot of this can be quite concerning, and there are different things that can lead to vaginal lumps and bumps. I've got a couple of really good videos I can draw your attention to go and see possible causes. And we've talked about things like Bartholin's gland, cysts and abscesses. We've talked about infection. An ingrown hair can go on, not only just cause inflammation of that area, which is a lump in itself, but even that lump in itself can become infected. So there are different things that could be responsible. So I think for this dear individual, this dear viewer of mine, please do get your doctor to have a look, or to have a chat with your doctor. Let them have a look at your medical history, and then find out what could be responsible for this. Okay, so let's take just a moment's break, and then we shall come back and look at Depo shot and pregnancy. Right. Welcome, everybody. Welcome back. So we're talking about Depo shot and being pregnant. And I get this question a lot, and I understand why. And I think I have addressed it probably in a previous video. We're going to make this is not going to be too long. We're just going to take a couple of minutes to look at this particular issue. And I promise I'm going to link this video. I don't know if I'm going to split, well, maybe not, but I'm going to link this video to the people that sent in this question, because I really want you to sort of have a look, and hopefully this clarifies the inquiry. Again, let me just make sure that there's a clear disclaimer that we're just talking about this for educational purposes. I'm not trying to replace your doctor. We don't have I'm not your physician, because I don't have access to your medical information. So please bear that in mind, that yes, we can sort of provide information that can help to signpost, help you to sort of think a bit more widely, and then you can go and sit down with your doctor. You can go through the full details, and then take things from there. And of course, I do have the email health information service that's linked to our website, AskAwayHealth.org. So you're welcome to send an inquiry there. The link is in the description for this video, or it will be once I finished this video, and I'll put it in the link. And you can send a question. We can sort of look at it, get a bit more information from you, and then address your inquiry. All right, so this person sent this message through to us and said, I just got my period 13 weeks after being off Depo. Can I get pregnant? So this is really interesting, because I've had inquiries from women. In fact, I did a video. Do you know what? I don't know if I can find it. I did a video on somebody who had she'd been on Depo, right? And was it 5 years, or how many years had she been on Depo? And then she was worried about the chance of getting pregnant. So she'd been on Depo for, was it 5 years or 10 years? It'll be in the, let's see, it'll be in the playlist. I'm just trying to see if I can find that particular, because I've got a Depo shot playlist. So if you've got plenty of questions around using the Depo, if you want to consider that as a method and you want to learn about it, or if you are on the Depo at the moment and just, want to understand why this is, I've got a proper playlist with 11 videos. Imagine 11 videos. Oh my God. So let me see. Let me see if I can find it, then I will just share my screen and let you know where you can find it. So all about the Depo shot, here are the videos. So I don't know if you'll be able to, let me see if I can share my screen. Bear with me a moment. Share screen, videos. Okay, so let me share hopefully you can see that. And I'm just showing you Depo shot makes me sleepy. So I looked at side effects of Depo, but the one I want, oh yes, this is the one I want. So it's this one. How does the Depo shot affect pregnancy after 5 years? So this is somebody who had been on the Depo shot. It was an actual question. So it wasn't me just trying to bring out a hypothetical example. This is somebody who actually had that experience. So please go ahead and check out that playlist for people who have been on Depo for a number of years, as many ladies can be, and are wondering about their chances of pregnancy. But responding specifically to this one, I just got my period 13 weeks after being off Depo. Can I get pregnant? Okay, so we know that the Depo shot, for those who don't know, Depo shot is the progesterone injection, a very effective form of birth control, and one of the things that many women associate it with. Some women have very good experiences, others not so good. But one of the things that many women associate it with is the long return, or the delay in the return to fertility that is associated with using the Depo shot. Now, it works by suppressing temporarily suppressing ovulation, which is where your body releases a mature egg every month. So it does that temporarily. It can also, a progesterone as a hormone will also thicken the mucus of your around the cervix, or the mucus that's produced by your cervix, the cervical mucus. And when it does that, makes it harder for the sperm to travel, and so makes fertilization difficult, or it makes it less likely. And then it also works on the lining of the womb, making it more difficult for an egg, if an egg is fertilized, to be able to implant. So it has a combination of mechanisms by which it works, but the primary thing it does is to prevent prevent ovulation while you're on this medicine, or while you're on the Depo. And when you stop taking it, you'd have a period of time. For many women, they would return, their fertility will return usually within a 6-month period. But there are quite a number of women where the return is delayed for several months. And the literature, or the some of the studies and research that people have done indicates that it could be 12 to 18 months. So there is a long delay. Now, this person has just got their period. So this is not somebody in that category. She's gotten her period 3 months after being off the Depo. And this is the experience of quite a number of women, which is, that's sort of a fairly reasonable return for the Depo. Although that said, if it was the pill, whether it's the mini pill or the combined pill, or the implant, for example, you tend to have your fertility return pretty much within the next few weeks. So that's why, if you're not ready to get pregnant, you need to make sure you're replacing any of those methods with, whatever alternative you want to use. But they have faster returns compared to the Depo. But this particular case that we're looking at here, this is a considerably quick return to fertility, because now she's ovulating. The fact that she's got her period, we can, for the most part, assume that she started ovulating, because it is possible for some people to experience certain bleeds and it's not necessarily a ovulation going on. But generally, we can accept this to indicate that the hormone suppression is wearing off, and her normal hormones are come back into activity, and she is ovulating. Thank you so much for guys joining in. I really appreciate your taking time to spending time with me. And you might have a question on the topic, please pop it in the comments section below, or if you're watching the replay, please send in a question and we might address it in a future video. But give this video a like, and please consider subscribing to the channel. We talked just a few moments ago about vulval itching and possible causes, and now we're looking at pregnancy after the Depo. So we've just been saying that there can be a delay, and this particular case we're looking at looks like had a brief delay. When I say brief, I'm talking up specifically about the Depo, but it is possible for women to get their periods back within under 6 months while on the Depo. But some other women can take a lot longer, sometimes a year, sometimes 18 months. And I know that can be really worrying. So it's not unusual. She's got her period back. It's 3 months. She's been off the Depo. Now she's asking if she can get pregnant. Well, there's no reason why she can't get pregnant. Okay, remember, we don't have much information about this. Is all we have. All this is all we know about this person. We don't know how old they are. We don't know what other conditions they have. We don't know anything else. So technically, yes. However, there are some things that could affect her chances of getting pregnant that are not the Depo. And I always say this, ladies, please remember, okay, if you're on the Depo shot now and you're thinking, okay, you're not really about to get pregnant for another couple of years, okay, fair enough. But if you're thinking that next year, maybe starting from February or, March or whenever next year is when you want to start actively trying for a baby, then you should really be thinking about coming off the Depo around this time. That is, coming off the Depo to some other alternative. And it's up to you. It's up to you. You can decide, right, you're going to stick with the Depo, that's fine, because it might just be the most convenient method. That's not a problem. But given that so many women could experience delays, and sometimes we say, listen, when it's going to 6 to 9 months beforehand, perhaps you want to switch methods. If you don't mind, you might want to go to the mini pill, you might want to go to the implant. It's just a thought, it's a consideration. And there are no hard and fast rules. But if you're at that stage where you think you would really rather not have to wait 12 or 18 months just in case, to get pregnant, then it's something to consider, just given the nature of the Depo. And then I need to say that there's also no guarantee. You might be one of those people who stop the Depo, and like this lady, you'll get your period within a few months, within 3 months. So we don't know. We can't predict many times who's going to get their periods back within 6 months or who isn't. Anyway, so I was going to say that the Depo is not what is stopping your fertility. The effect on the ovulation that the Depo has is temporary, and it will wear off. Okay, I mean, imagine that there's some people who fall pregnant on the Depo. It's because it's highly effective, yes, but it also has a small failure rate. So there are some people who have gotten pregnant while on the Depo shot. So I want to say that when you stop it, the drug gradually wears out of your system, and so your body's own natural cycle will begin to wake up, and then the effect of the hormones from your brain and acting on the ovaries, that gradually begins to come back into play. Okay. But I think what is also critical is how old are you at this stage, okay? If you're 30 or 35 or 38 and you've been on this Depo for 5, 6, 7 years, the quality of your eggs now compared to what it was when you started the Depo is clearly quite different. And of course, you might find that at that point, it might be more difficult, or it might take a bit longer. I'm not saying it's impossible, but it might take a little bit longer to fall pregnant. So age is a factor, and that's nothing to do with the Depo shot. Okay, so it's really important that we're aware that age is a big factor. Other things could be your weight, because sometimes being overweight might also affect fertility. Other possibilities are other conditions that you might have that while you were on the Depo were not particularly an issue, or that you were not even aware of. For example, there's some ladies who have PCOS or other conditions like fibroids, okay, that could come into play. Now, I'm not saying that they would definitely affect fertility, but they may. It's all very individual. So if we're going to respond to this question, can you get pregnant if you're well? If you don't have any other pre-existing medical problems, if you don't have any other issues, you're not taking any other medication, then I don't see why you can't get pregnant having regular unprotected sexual intercourse with your partner. So that is the only answer one can give in this instance. And so for anybody who has something else, some other part or something else going on in their medical history, then of course they will need to sit down with their practitioner, sit down with their doctor and sort of go through that. But I think that will be the best way to address this, that yes, the Depo isn't going to stop you from getting pregnant. It's when you stop taking it, its effect on fertility is not permanent. Once you've stopped taking it, it does begin to wear off. But there's some people who might experience delay, not in this particular case, but there's some people who might experience delay. And when you stop taking it, please don't stress. Please don't stress. Let it happen naturally, okay? Keep yourself healthy, physically, mentally, emotionally, okay? Eating well, taking folic acid, exercising regularly, and, you know, keep yourself in a place, in a good frame of mind, free of stress and not just sort of worrying about it. Enjoy the whole process of trying to have the baby with your partner, and don't be so worried about, oh, I'm not getting pregnant, could it be the Depo? And that said, of course, if you still have concerns, perhaps you guys have been trying for a good amount of time. So, for example, after your 30s, if you've been trying for 6 months or whatever, around 6 months, then yeah, go and speak to your doctor. You don't have to wait ages. Go and sit down, have a conversation. Maybe they need to do tests for yourself and your partner. Generally in the UK, under the age of 35, excuse me, under the age of 35, we're looking at after 12 months of unprotected sexual intercourse, at least thrice a week. And if there's no pregnancy, then most people will be referring most people wanting fertility treatment or to have a discussion about their fertility and their chances. We'll be referring them to the gynecologists. So for people who are older or for people who have other medical conditions, we don't wait a year. So as soon as you've got any concerns, I would say go and sit down and discuss it with your doctor. Okay, friends, I think this is all we've got time for today. I think it's actually carried on longer than what I'd planned. Thank you so much for watching. Give this video a like and please subscribe to the channel. I will place the links to the playlist, the email information service that you can use and send in your questions. I'll put that once we're finished with this video. And yeah, thank you so much for joining me. Have a great week. Take care and see you again soon. Bye-bye.